The country just breached another pandemic milestone. On Tuesday, total COVID infections topped 3 million as an additional 28,000 contracted the virus. Cases have been soaring to new heights since the year started, even reaching a high of 33,000. The health department did not mince words in describing the situation.
Ang ating bansa ay kasalukuyan nasa critical risk case classification na may pagtaas na 690% sa atin pong 7-day moving average of daily reported cases.
Health Secretary Francisco Duque laid down the grounds for declaring such. Two-week growth rate have skyrocketed more than 3,600%. Average daily attack rate climbed to 10.47%, while positivity rate is 40.4%. This as the Omicron variant has overtaken the Delta variant in the country's latest sequencing run.
So siya na po yung nag-dominate na variant, whereas before it was the Delta. So 60% of all the sequence runs ay Omicron na po.
But the Philippine Genome Center stopped short of calling it the dominant variant in the country. So far, 43 Omicron cases have been recorded in the country, 22 of which are international travelers.
Based on our data, Yusek, marami pa ring Delta. We need to have further evidence po. So yun, Yusek, ang ating DOH po gumagawa ng sampling sa different hospitals and institutions around the country so that malaman talaga natin yung situations.
As cases soar, the pressure escalates for the healthcare system, with more and more medical staff getting infected. The Department of Health decided to shorten isolation time for COVID-positive healthcare workers. The DOH says augmentation is ready if needed.
Ang reason naman na naging 5 days yan for the, especially for the asymptomatics, is because we believe that on the 5th day, if you're vaccinated, the viral load is very low, and you are no longer you can no longer transmit the virus to, or you are not contagious. 93% even with booster.
Acting presidential spokesperson Carlo Nograles assures the public that the government is ready in case there is a need for a more restrictive alert level. The IATF is set to meet on Thursday to discuss alert level status and travel classification of different countries. For News 5, Maricel Halili, We Are One News.
The entire Philippines, not just Metro Manila, is now considered at critical risk for COVID-19. But are the testing centers outside of NCR enough to give us a full picture of the COVID situation? That big question and more with Dr. Jaime Montoya, Executive Director of the DOST-Philippine Council for Health Research and Development. Good evening, Dr. Jaime, and welcome to The Big Story.
Yeah, good evening, Robbie, and good evening to all your viewers and listeners.
Sir, balikan ko lang po yung question that as we introduce this segment, yung testing capacity natin. A lot of people, in fact, are testing at home, as you know. What does that mean for the real picture beyond the headline numbers that we're seeing?
Well, because we already knew for a fact that even before this surge happened, that with the introduction of the Omicron variant, we really expect the cases to go up. And especially as a carryover from the holiday mobility reunions and activities. So we've actually prepared for the increased demand for testing, and that is why the FDA, together with the Department of Health, has already laid down policies for actually expanding not just RT-PCR testing, but also antigen testing. And this time, also allowing home testing for as long as certain criteria are followed.
Now, kanina pa sinabi ni Secretary Duque, and I think lumabas na naman po sa balita to, sa mga na-sequence, 60% are Omicron. This is short of anybody acknowledging that Omicron is already the dominant variant. Pero ano po ba implications nito? If Omicron is in fact the dominant variant right now, what implications will that have on strategy?
Well, as we've seen in other countries, in the US and in Europe, they may be at this stage also like us initially, wherein they're not sure whether it's going to be the predominant. But the conclusion always is that it's just a matter of time. And at the rate we're going, as far as increased cases are concerned, and even by the sampling that the PGC has done, that per sample run, they are seeing 60% of cases actually due to Omicron, it really gives you an idea that if you look at the general picture, if you're given the opportunity to sample everyone who are tested positive, the likelihood of being the predominant strain is there, and it's just a matter of time. So the implication really is that we're going to see more cases because of what we already know about Omicron variant. It does become the predominant strain. It's more infectious, so there's a higher likelihood of super spreaders out there. Some of them may even be mildly symptomatic and very mobile, therefore spreading more the infection. And so, although we say that it's less severe in terms of hospitalization and ICU requirements, but still we expect more cases in the coming days.
Okay, Dr. Montoya, maraming salamat po. That was Dr. Jaime Montoya, Executive Director of the DOST-Philippine Council for Health Research and Development.
Thank you.